In this video, brief video, I'm going to go over the parts that you need to know in the sagittal head. So where I am looking, I'm going to go back and forth here. I'm going to look here, number 5. We're looking at the mouth and the pharynx area. So there's lots of parts on this sagittal head. You don't have to know all of them for this lab. The rest of them will be in the respiratory lab. Depending on the year, you may be doing digestion first, or you may have already done respiration. It just depends. So when you look at this, just focus on the ones you need to know. And the ones you need to know are the ones on this list. So we're going to look at the hard palate, soft palate, uvula, the cheeks, the oral cavity, and then the 3 parts of the pharynx. And then we'll look at the tongue also. Okay, so what you need to know on this is the pharynx. Okay, the pharynx goes from, this is the nose, it goes from the back of the nose, the pharynx, all the way down to here, which is the split between the trachea and the esophagus. In digestion, we are concerned about this transport down here into the esophagus. So, the parts of the pharynx that you need to know, and they're named based on the region they are located. So the nasopharynx is right in this region. So naso, close to the nose, okay, close to the nose. B is the oropharynx. Here's the mouth, okay, here's the mouth or the buccal cavity. And then here's the oropharynx, so behind the mouth. And then as you get down here, this is the larynx. Okay, this is where air is going to go. So this is called the laryngeal pharynx. This is right before the split between the larynx and between the esophagus. So here's the esophagus. Now this is not on your list for this one, but I mentioned this in the lecture videos. This is the epiglottis. This is the little flap that's going to come down when you eat so that food is forced back to the esophagus. Okay, forced the esophagus. So those are the 3 parts of the pharynx, which you do need to know for the digestion lab. You also need to know, just to give you some idea, here are the lips. Okay, here are the lips. Here's your little nose. So here is the hard palate. Okay, this is bone. Okay, this is bone. This is the top of your mouth. So that is the hard palate. So if you remember, that's the maxilla bone. Okay, the maxilla bone. So that is the hard palate. Behind the hard palate, so the hard palate is this kind of reddish white area, the bone. The soft palate is behind. The soft palate is behind the hard palate and is not bone, and it's all of this right here. Okay, it's this eye, this whole area from here to here. Okay. Now, the end of the soft palate is called the uvula, and that's right here, also known as the little floppy thing in the back of your mouth. So when you open your mouth and you see that little thing in the back, that is the uvula. What the uvula is supposed to do, and most of the time it does, is that when you eat, you force food here, the uvula goes up, keeping food from going up your nose, okay, keeping food from going up your nose. Now, if you're laughing, then what can happen is your uvula can fail, and you can actually get milk. Okay, people most commonly get milk up your nose and come out your nostril. I actually had a student once who said that she said it was very, very painful, but that she was eating M&Ms and laughing, and that M&M actually got stuck up in her nose that actually came from her mouth. And some people who are very talented can actually eat a piece of string, not eat it, but put a piece of string in their mouth and somehow work their mouth that they can actually make the string come out of their nose. So don't try that at home. So hard palate, whole thing is soft palate. If I put the pointer at the very tip, then I'm looking for the uvula. If the pointer is in this region, then I'm looking for the soft palate. The last things you need to know on this model are, and let's look at the lab here. Let's try to look at the lab. Trying to look at the lab. So we did this. The cheeks, your cheeks are your cheeks. I can't really point to that. Your oral buccal cavity is basically your mouth. And again, that would be difficult for me to point to. So we got the pharynx. We talked about the esophagus. Do not worry about the upper esophageal sphincter. I can't really point to that, and I will do this cardiac sphincter in another video. We'll go through the stomach. We'll go through all those things. We'll go through the salivary glands. They are located in this region. They're just not on this sagittal head model, so I'll show you a different video with that. So your corpus lingua is your tongue. Your corpus lingua is your tongue. The lingual frenulum, I'll show you where that is, but it connects to tongue to the lower mouth, so make sure you know that, because again, it's hard to point to. And the papilla of the tongue, I'm going to show you a microscopic picture, is actually the pattern that you see on the tongue. And again, you can't see that on a typical model. So if we go back to this, This is your tongue, and right here is the corpus lingua. All right, so you're going to use the technical term for it. And then your lingual frenulum is right here, and that's what's connecting your tongue to your lower mouth. You may have heard when someone's tongue-tied, babies can actually be born, their lingual frenulum can go too far, and they can't actually move their tongue efficiently, and so they can't suck well. And so for babies, sucking is important because they're either going to suck a breast or they're going to suck a bottle. And if they can't do that well, it could be because that lingual frenulum's too tight or too far there. So again, tongue, lingual frenulum. So you need to know that. Okay, you need to know that. So that's what you need to know on this model. Again, when you look at this, when you look at the picture, don't get overwhelmed. You just need to know the parts for this lab. The rest of them that's not on this lab will be as part of the respiratory lab. Okay, that's it for this.